Yeah, hi everybody. My name is Kuhan from Core Physiotherapy Pilates, and today I just want to talk a little bit about the TENS machine. So, TENS is actually short for Transcutaneous Electrical Nerve Stimulation. So, transcutaneous means across the skin. So, it is just a method in which there is a small amount of electrical impulse which is going across the skin. So the TENS it is a method of pain relief, which as I explained earlier, it's involving the use of mild electrical current. So a small amount of electrical impulses are delivered to the affected area, and you will feel a slight tingling sensation. And the electrical impulses which are sent will actually reduce the pain signals which are going to the spinal cord and to the brain, and it will help to reduce your pain and also to relax your muscles. And there's also it may also stimulate the production of endorphins, which is our body's natural painkillers. So you can actually reduce the amount of painkillers which you consume. So now I will just go slightly into the machine. So this is how the machine is. It is small, it is portable, it is easy to carry the machine around as you go, and you can use it even when you're going outside anywhere. So this is how the machine looks like. There are two channels over here. This is where you adjust the intensity of the currents, and just to access the area, so you just have to open it right here. And the first thing you'll notice is the pulse width and the pulse rate. So the pulse width and the rate are actually usually standardized to these settings, unless the physiotherapists will like to change it. And as you can see over here, there are both modes, which is B stands for burst, C is continuous, and M is modulated. So you can just adjust the modes according to your the settings that your physiotherapy has prescribed. And burst b the so burst is actually there are two amounts of current burst which happens in 1 second, and typically we use it for chronic pain. And then when you go to c, which is continuous, so there's the continuous current, as it implies, it comes continuously without there's no stopping in between. And typically we use it for acute pain, which is a freshly injured area. And then the last one, which is modulated, it is typically there's always variation to the pulse width and to the pulse rate, and according to your physiotherapist, then the settings will be changed. And we usually can either use it for fresh injuries or for chronic pain. And then down here is the timer. So as you can see, the C, 30 and 60. So C, it is continuous, so that means there's no stopping to it unless you manually stop the machine yourself. Otherwise there's the current will just continue going. And then there's 30 minutes, and then there is for 60 minutes. So accordingly you can adjust to that. And now I'll just add in the battery here. So so you just have to close it here. Okay, and then just to access so these are the wires which are given together with the machine. And to connect the wires to the machine, you just have to put it into the area, into this channel electrodes. So one will be here, and then the other one just put it in there. And these are the electrodes. So the electrodes will come with four, and there will be four electrodes together. So this is one, this is the other. Okay, and then just to connect the wires to the electrode, you just have to put it into this area here. So you just have to twist the wire a little so it enters. Sorry, it's a little difficult, so you just have to twist it a little. Okay, so I'm connected to a single channel now. And then for the other one, just connect the same way. Okay, so now we are connected. So these electrodes are one channel, and this is the other channel. And to turn it on, now you can see it's blank. So once you just turn the knob slightly, you can see a green light. So it means that the channel is active. And now for the other one, you just have to turn it on and you can see the green light. So when you want to start the treatment, you just have to turn the knob slightly, and the basically according to your pain tolerance, then you can increase the intensity, and same with this way. And once you're done with the treatment, you just turn the knob slightly and until you hear the clicking sound. Same here. So once the green light is off, the channel is inactive, and then you can just take out the battery and